a slightly degraded form, a slightly adulterated form, and a cheaper form. The pure form of heroin is very costly. 1 gram would be about 10 to 15,000 rupees. But here, what we get in the street, locally known as sunflower, you get it for about 3 to 4,000 rupees. So we will discuss a little bit about that, but to begin with, I just want to clarify a few concepts. First concept that I want to clarify is the word addiction. What do we mean by addiction? Medically speaking, when we say addiction, we mean compulsive use, repetitive use of a certain substance despite the negative consequence. Smoking is an addiction. You know it's bad, but you keep doing it. You can't help it. It's a compulsive use. Unconsciously you smoke when you're stressed out. Drinking it's an addiction. You know it's bad for your health, it's bad for your family, but you can't help it. You use it compulsively every day. So also when we talk about drugs, we call it drug addiction because it is such a compulsive habit that you do it despite the negative consequence. Yes, he has rightly said these days we don't use the word drug addict. We use the word substance abuser. It is a little more politically acceptable. Drug addict is considered politically incorrect. You know, these people are also very smart, drug users. And when we say drug addict, it means we mean in a very derogatory sense. It has a very derogatory connotation. Because of that, they have so many human rights legal people to plead on their behalf, and the word was changed into substance abuser. So because of that, nowadays we don't use the word substance abuse. So addiction simply means compulsive desire to repeatedly use a substance despite the negative effects. The other thing that I want you to know is substance. When we say substance, we mean alcohol, we mean drugs, we mean cough syrup, we mean all this ganjas, cocaine, everything comes under substance. Then the other thing that I want you to know is psychotropic drugs. He has also mentioned a little bit. Whatever I'm going to say there will be a little overlapping of what he has already said. Psychotropic drugs, they all come under this. All this heroin, alcohol, ganja, all these psychotropic drugs have a special ability to cross the blood-brain barrier into the brain, okay? Every drug that we take doesn't go to the brain, okay? Some of them act inside the stomach, some of them act on the point of infection, some of them act on the bone, some of them act on the muscles, but some drugs has a special affinity for crossing the blood-brain barrier. Inside the brain, we have a barrier that does not allow all drugs that we take to go into the brain. So these substances are called as psychotropic drugs like alcohol, heroin, and all this that we are discussing about today. And these drugs, when they enter the brain, they sit on some receptors, a place where they can sit and exert their action. And they influence our feelings, our thoughts, our emotions, and our behavior. These substances are called as psychotropic drugs. Very, very powerful drugs. The other thing that I want you to be conversant with is the word use, abuse, and dependent. Very often used in our discussion. Use, he has already said a little bit, an occasional recreational use. The other day we had a birthday party and I had a can of beer. That's called use. I don't use it every day. I don't drink every day. The other day, next day, I'm back to my office and I can function normally. I don't need to be treated. I don't need to be given any counseling for an occasional use. That's the word use. All of us had used a bag of alcohol or a glass of beer at one time or the other. No problem. We don't consider that as a problem. You don't need to be treated. The other word that we need to be conversant with is the word abuse. Abuse means now you are using it almost regularly. You know it's causing you some harm, psychological harm. It is causing you some harm in your relationship. It's affecting your budget. It's affecting your health. You know the negative consequences that is coming with your habit. But you can't give up. And you continue to use it every day. This is known as abuse. Okay? The third term that we need to be conversant with is dependence. By now, you are using your substance every day. You need it to feel comfortable. The body needs a certain dose of your drugs and his alcohol every day to remain in a state of comfort, to feel normal, to feel good. And when you don't use it, you begin to start having some problem. You start craving for it. You start having withdrawals. Because of your use, you start neglecting your responsibilities, family responsibilities, occupational responsibilities. Because of your dependence, you're beginning to have some conflict with the law, with the police people, and some problems with your health. Finally, you have been abusing for the last 10, 20 years. It's beginning to take its toll on your physical health as well. So this is known as dependence. Okay? Use, abuse, and dependence. These are three words that we use very frequently in our discussion. So what happens when you do sunflower? You take in two forms, either in injectable form, for which we call them IV users, IDUs, intravenous drug users, IDUs in normally. We can take in injectable form, or we can chase. The powder is put on the foil, a plastic foil, and you burn a lighter under the foil. When it evaporates, you sniff the smoke. When you sniff the smoke, when you inhale it, it goes straight into the brain. Not to the liver, okay? It goes straight into the brain and it sits on those opiate receptors. Opiates are these substances that he has just said. Opiates are heroin, opium, SP, phosphoroproximol, Relipen, then cough syrups like codeine cough syrups. These are all called as opiates, okay? And why this is so popular in our society, even in America, is because of its pleasant effects it produces in the brain. So when you sniff this substance goes straight into the brain and they sit on those receptors, opiate receptors, and they exert their action. Okay? When they exert their action, it produces some neurotransmitters inside the brain. They call it dopamine and endorphin. These are called as the pleasure hormones. You feel good, relaxed, calm. You feel like sleeping. You may even go to sleep. It gives you a very, very dreamy state of mind. And since it feels so good, so pleasurable, when you're not doing it, you start craving for it. Okay? Do you know this fact that the whole body, the whole brain is wired for pleasure? This is the way God has made us. And when you're not getting it, you crave for it. Just like having a nice dish of pork. You crave, you feel like having a nice pork dish. No, same thing with drugs and alcohol. When you're not doing it, you start craving for it. This is the reason why people go back and do it again and again. It becomes a vicious cycle and you can't give up. When you give up, you begin to suffer from withdrawals. Okay? And this is how it works. First, you start with an occasional recreational use. And as you keep doing it, the body starts developing tolerance. Something known as tolerance. Earlier, one sniff was enough to make you get the high. But as you keep doing it for 2, 3 years, 4 years, the dose has to increase. The body tolerates. The same dose will not give the same high anymore. You need a higher dose. Some of our clients, they go to that extent where they spend more than 5,000, 10,000 rupees every day to get the same high. Earlier, when they were starting, they were spending just 1,500 rupees. Now they have to go to spend 5,000, 10,000 rupees to get the same high. This is known as tolerance. The same thing goes for alcohol. You start with one peg. One peg for a non-drinker is enough for you to make you feel tipsy, high. But as you keep doing it for years, you'll need 2-3 pegs, half bottle, one full bottle. This is known as tolerance, okay? So it starts with a recreational use. Slowly it gets graduated into a tolerance. You have to up your dose. Then a time will come when you will start having, you will proceed into the stage of dependence. I told you, when you reach the stage of dependence, by now the body has become so used to getting his daily dose of sunflower that he cannot survive without it. When I don't get my stuff this morning, and by the way, this sunflower acts just for about 4 to 5 hours. So when I'm not doing it this morning, by now, normally they have the dose around 6, 7 in the morning. By 10, 11, 12, if they're not doing it, they'll start getting the withdrawals. Withdrawal means you're not getting your stuff and now the body is beginning to react. It's a very, very distressing experience. A very painful experience. Joint pains, nausea, running nose, diarrhea, irritable, anxious, angry with everybody. Very, very distressing. And suppose I get back my substance and I sniff it. I feel good once again. All my pain disappeared. See, this is the reason why you can't give up. It becomes a vicious cycle. Okay? This is how you become an addict. And by now, this fellow has reached the stage of dependence. He's beginning to have withdrawals. When he's not using it, he'll crave for it. He'll search here, there, everywhere. He'll do everything, anything at his disposal to get his substance. This is known as the stage of dependence. By now, he has been abusing for the last 5, 10 years. Some physical problems will also be there. These people who do drugs every day, they have very poor appetite. They don't eat well. So there will be gradual loss of weight. Cacaxic, they will look emaciated. They will have other related problems like abscess. They will have TB. Some of them might have already contracted HIV/AIDS. So these are some of the complications related with dependence. And by the time dependence is reached, you would have dropped out of school. School dropout, one of the reasons for school dropping out is because of drug abuse. If he's an office goer, he will never be regular in his office. Every day, sometimes on, off. All his performance in his workplace will be neglected. His family responsibilities will be neglected. See, drug abuse is one disease that affects every aspect of the individual. Not only his physical health, but it also affects his mental health. It affects his social health, relationship with the family. It affects his relationship with the society. Every aspect of the individual gets affected. There's no other disease that affects like the disease of addiction. Addiction is also, by the way, it is considered a disease. Okay? So these are some of the harmful side effects of this drug abuse. So they go into tolerance, into dependence, and sometimes if the patient is not very careful, it quite results into a state of overdose. We have often heard of it. Overdose quite often we see that. Just recently only at KJK also, one fellow was found dead. And last month, one fellow was found dead near our house in our village. He was dead in his gypsy. He was found dead. And then gradual, all this analysis went into, and then they found out that he had overdosed while driving. So this kind of accidents can happen. So this is the fatal consequence of drug use. Okay. Now, why do people, in our context, why drug use, substance abuse is so high in Nagaland and the Northeast? I've done a small study and I found that there's some unique features, unique to our society, which made substance abuse quite rampant in our society. One feature is the social acceptance. One factor is the social acceptance. Alcohol is socially accepted. It was there in our culture, even pre-Christian times. Even now, it is, despite the Prohibition Act, it is still so much prevalent in our society that nobody really takes it very seriously, people getting drunk. So because of its social acceptance, the substance abuse is prevalent. That is one reason. Another factor that is unique to our society is, I think it's because of too much leisure time. I used to work in Delhi and Bombay previously. One thing I noticed about the society is they drink, but they don't drink the whole day. After work only they drink. In Bombay, where I studied last, people are so busy. You get up in the morning at 5, 6, hurriedly eat your breakfast, dress up, rush to the train station, and then go to your work. It takes about 1 hour, 2 hours to reach your workplace. Work the whole day. After 4 or 5, chutti, come back to the train station and come back to your house. By the time it's already 7, 8. Too tired. Dinner hagine 8:30, 9 to And one thing that I have noticed is there is no time to abuse. In our society, the work culture is so lousy. I tell you, before 11, office day jale kun kevin na pa bade. After 2, 3, we hardly work for 3 to 4 hours, and we insist on hiking our pay. Sometimes I see a strong contradiction between the amount of and quality of work and the amount we expect. Sometimes it's a little, unreasonable. Let us be easy on our government sometimes. It's so full of criticism of the government, no? I feel pity for our ministers here these days. At least I'm one who feels pity for the government. Anyway, the work culture is so bad, we hardly work. And what do? Most of the time is leisure hours, free time. Now what happens? Leisure hours, either you spend it on some active recreational activity like games, sports, but we don't have that activity every day. So for most of our young people, the immediate thing they can think of is having a good time. When 2, 3 boys meet, they talk about having a good time. So the only thing they can think about is going to a motor joint or a drug joint. By the way, heroin, today we're discussing about sunflower only. But there's a greater danger than sunflower. Alcohol. Alcohol is the main danger. We should have another interaction like this on another time. But we must address this issue of alcohol in our society today. This is the chief wrecker of homes. It's one of the main problems for all domestic issues. So we must address alcohol also another time. So this is having too much leisure hours and too little recreational facilities is probably another reason why a lot of young people are going into drug use. And another thing that I have noticed about Naga parents is many of them are not very educated, not very well aware about the consequences of drugs and alcohol. And they don't mind so much. A lot of parents are negligent, a lot of parents are uninvolved about and unaware about what the children are doing. So bad parenting is also one factor, okay, why this substance abuse is so much prevalent. Another factor that I have found out in my study was a lot of parents just give pocket money, loose pocket money. 50 rupees, so mangile, it's so easy having a easy pocket money. I tell you, if you have no money and if you want to abuse drugs or abuse alcohol, it's just impossible. But when you want to abuse and when you have plenty of loose pocket money in your pocket, it becomes easy. And also that in the hands of a youngster. And I tell you, another finding is a lot of our clients started young. It becomes difficult for you to start after you have crossed 20, 21 to become a drug user or an alcoholic. Very difficult to become. By now you have already matured. But it is much more easier when you are younger. A lot of them start around class 5, 6, 7, 12, 13, 14 times there. Impressionable years. Peer influence is very strong. Everybody is doing it. So you feel out, you feel left out. You feel the odd man out when you're not doing it. Peer pressure para join. This is another reason. So these are some of the social reasons why this drug abuse is so much prevalent in our society. Another point that I have just forgotten is a lot of unemployment issue with our present generation. Presently, I don't blame the government also. The situation is such, we have too many people totally dependent on government jobs for survival, that a lot of people are finding themselves unemployed. I blame the society, I blame the government, I also blame the education system for producing so many unemployed people. But right now, I think there are, besides the agitation that is, we have all seen it in the newspaper, but besides that, according to one statistical report, it says that about 90,000 youngsters are unemployed at the moment. When NPSC comes, there are more than 20,000 candidates vying for 100 vacancies. Very, very pitiable condition our situation is. So in a situation where we have a very high level of unemployment, a lot of young people are now indulging in drugs and alcohol. Because of frustration, because of too much stress. Yes, another reason why a lot of Nagas indulge in all these activities is because of the level of stress that is increasing in our society. Anxieties and worries are increasing every day in our workplace, in our day-to-day life. This anxieties and worries will never go. As long as we live here on earth, we'll keep having it. But a lot of people like to indulge in all these drugs and alcohol activities to cool down. In fact, the funny thing about these drugs is, opiate drugs and alcohol, they relieve your stress. Okay, when you drink, I told you, they produce endorphins and dopamine in the brain. It makes you feel good, relaxed. That's why a lot of people like to take a couple of bags of drinks or drugs to relax. But it's got so many side effects and it's got so many negative consequences that we don't prescribe a packet of cigarette a day to relieve your stress. We don't do that. So these are some of the psychosocial reasons why it is so much prevalent in our society. Now regarding the management, it's a long topic. It's a long, very, very complicated topic. I would rather feel a little more expressive if we start our interaction. If you can ask questions, we will have so many things to tell you. It's over our years of experience working with these people. The treatment is don't drink. Do you think it's possible? It's not possible to give up drinks. Very, very difficult to give up drinks or drugs. Very difficult. In the movie that we just saw, when the local boys pulled the boy up, bashed him, and threw him into the in front of the parents. No, the boy was pleading, "Please, Lord, please have mercy." He was, that state of helplessness. No, see, it exactly described the situation of the plight of the drug user. He's in a very, very helpless and hopeless situation. We need to understand them and empathize with them. Not encourage them, but understand them and approach in what way we can help ease out this problem. I tell you, the best way the church can the church can intervene is through preventive activity. The prevention is the best medicine. To my experience, it is once you get into it, deep into it, very, very difficult to come out. We have been treating them. Many of them relapse after treatment. I have two problems in my own family. I have two brothers. One is an alcoholic, one is a drug user. Because of that, I got in deep into this field. I said I must know very well about this drug so that I can help out the society. So this is where we are. And I feel this is one area where the church can contribute, and that is through preventive activities, holding this type of activities among the church youth. And if all of you can go and have a awareness campaign among your young people, then even that is good enough. Then church, that is about the church activities. Schools also needs to address this problem. That is what we are, advocating everywhere we go. So today, let us have a little more in-depth interaction. You can feel free to ask questions.